Somebody wanted to know what's the difference between integral and transpersonal psychology.
Well, maybe I say a few words about both of them, as either of them, yeah?
Please, yes.
You know, transpersonal psychology is psychology that emerged in the late 60s. I actually had the privilege to be one of the few people, you know, who were at the cradle of it, with Abraham Maslow, Tony Sutic, Jim Fadiman, and you know, Sonia Margulies and so on. And this new psychology basically wanted to study the whole spectrum of human experience. Initially you had psychoanalysis and behaviorism, you know, psychoanalysis focusing on basically patient population, behaviorism studying just animals and trying to make sort of extrapolations to humans, and then a first reaction by Tony Sutic and Anthony Maslow was creating humanistic psychology that sort of corrected many of these kind of inadequacies of these two therapies. And humanistic psychology became very popular among lay people as well as professionals. But the founders themselves, within 10 years, became very dissatisfied even with this humanistic psychology that they created, because they realized they left out the spiritual dimension. Things, you know, that happened during meditation practices, that happened in these native ceremonies, in trance states, kind of creative ecstasy and things like that. So they started working on yet another psychology that they wanted to call transhumanistic. And they invited me to become part of it, and I was at that time calling a certain category of experiences transpersonal.
You were
when you transcend somehow the body ego, and you have experience of oneness with other people, or oneness with animals, or with nature, or you experience something from another century, past life experiences, mystical states, and so on. So they, instead of calling it transhumanistic, they started calling it transpersonal. And then integral psychology is something that came out of the work of Ken Wilber, who created this kind of remarkable synthesis of a variety of fields, you know, starting with what Huxley called perennial philosophy, you know, the Eastern spiritual philosophies, certain aspects of Western psychology, but bringing in, you know, biology, bringing in anthropology, philosophy, and so on. So that's a kind of an integral vision. And really, it would be very difficult for a psychiatrist, a psychologist, to use that in specific work with clients. I mean, as you work with clients, you have to narrow it. You know, you might have a worldview that includes philosophy and biology and you know, mythology and other things, but it's not something that you use practically. So transpersonal psychology developed methods that you can actually use working with patients, whereas what Ken Wilber developed, although you hear about integral psychology, it's really integral, kind of a vision, synthesizing many disciplines, and it would be very, very difficult to use it, you know, in practical work with patients. Actually, I admire very much the work he has done, but what I admire least is the psychological part of it. For example, he brought in the knowledge of the psychotherapists that all use verbal means, and basically limit their map of the psychology to postnatal biography, what happened to you in infancy, in childhood, but does not include, for example, birth, what I call the perinatal experiences, or the prenatal. And actually, from the larger transpersonal perspective, he sort of appreciates least the psychologist that I would appreciate most, which is Jung, you know. So transpersonal psychology is narrower. It's more sort of specifically focusing on the aspects of psychology that you can actually use in the day-to-day work with clients. Kant's vision is very sort of cosmic, philosophical, you know, but it's very difficult what you would actually do in practice. What he suggested at one point actually, that you analyze the person, where that person's problems are, and then you send them to a therapist who specializes in that.
In that particular.
Yeah. Whereas, you know, we work with the breathwork when you cannot do that, because the things that emerge spontaneously could be biographical, they could be perinatal, they could be transpersonal, and you as a therapist, you have to work with whatever emerges. You cannot say, you know, now it's birth, I'm going to send it to somebody else, or now it's past lives. I don't work with past lives and so on. So I think it's the integral vision, I think, needs some input, you know, from people who have worked with these non-ordinary states, which really don't get somehow their proper place in this integral vision.